Okay, let's unpack this. One of the really persistent mysteries, really, the past few years, has been that stubborn fatigue. So many people felt it after a COVID infection.
Right.
Even folks who, well, they had a really mild case, maybe were pretty healthy before, and they just found themselves dragging for weeks.
Yeah.
Sometimes months.
Yeah.
It's been super frustrating. It's like, why does that actually happen?
It's absolutely one of the defining features of post-COVID syndrome, PCS, for so many people, and understanding the mechanism, what's really going on behind it, that's been a huge focus for researchers globally.
Absolutely. And so this deep dive, it takes us into a really fascinating new study. This one's from the Medical University of Vienna, published in Allergy. And it points to, well, potentially a really big piece of that puzzle.
And what's really intriguing here, I think, is that the researchers, people like Eva Untersmeer, Elsenhuber leading the team, they aren't just looking at the virus itself, They're suggesting that maybe issues with the gut barrier and the inflammation linked to that could be key drivers of this lingering fatigue.
The gut, okay, huh? That's maybe not the first place you'd immediately think of. So our mission then for the next few minutes is to really dig into exactly what this team in Vienna found and why this specific link, between gut health and post-COVID fatigue is something really important for you to understand.
So this was what we call an observational study, and the team, Johanna Rohrhofer, was also involved. They really focused on tracking people's gastrointestinal health, their GI symptoms. They looked before, during, and after the COVID-19 infection. They wanted to see how things that were already going on, pre-existing conditions, might influence the outcomes.
Right, so not just watching the infection happen, but looking at the body's state going into it, specifically the gut. What did the data show them?
Well, what stood out pretty clearly was that individuals who said they had gastrointestinal issues, problems before they got COVID-19, they were significantly more likely to develop that really pronounced, long-lasting fatigue afterwards.
Wow. So it wasn't just random. It seems like there was maybe a vulnerability there already. Did they see biological markers, things backing this up when they looked, inside?
Precisely, yes. They analyzed samples, blood samples, and saw distinct differences in immune system markers in the group that was experiencing the fatigue. They noted an increased ratio of LBP to SCD14. You can kind of think of these as signals on the bloodstream that suggest the gut lining isn't quite holding together properly.
Like a leaky fence, maybe.
Yeah.
Letting things through that should really stay inside the gut.
Yeah. Exactly. That's a good way to put it. The gut barrier, it's meant to be a very tight seal. When it gets weakened, substances from the gut, they can leak into the bloodstream, and that can potentially trigger a systemic immune response, inflammation all over. They also found lower levels of something called IL-33, which is involved in regulating immune responses, and importantly, significantly elevated levels of IL-6.
Ah, IL-6. Yeah, that's a name we hear quite a bit when talking about inflammation, isn't it?
It is. It's a major inflammatory cytokine. Think of it like a widespread alert signal going off in the body. So elevated IL-6 is a pretty clear sign of systemic inflammation. So you've got signs of a leaky gut barrier, these altered immune signals, and systemic inflammation all linked together in the group with fatigue.
Okay, and here's where it gets, really interesting for me. This study, it focused mainly on young people, right? Previously healthy individuals. And their COVID infections, they were often described as mild, some even asymptomatic.
That's the critical part, yes. That's the really important takeaway here. This wasn't just something happening in severe hospitalized cases. It seems even a mild brush with the virus could potentially trigger this whole cascade. The gut barrier issues, the inflammation kicking in, and that leads to significant long-term fatigue, especially in people who might have had some underlying, maybe even quite subtle GI vulnerabilities to begin with.
So, okay, what does this all mean then? If gut barrier function and inflammation are potentially tied to this fatigue, what's the big picture implication for you listening?
Well, this research really puts the spotlight, I think, on the gastrointestinal system, how central it might be in the long-term effects of viral infections like COVID-19. It suggests that maybe by looking at a person's prior GI history and perhaps monitoring these specific biomarkers, the gut barrier indicators, IL-6 doctors might get better at predicting who's at higher risk for developing this kind of post-viral fatigue.
And identifying that risk earlier, that could lead to different approaches maybe, different treatments.
Absolutely. I mean, instead of just general advice, future treatment strategies for post-COVID fatigue could potentially become much more targeted. They might focus specifically on supporting gut barrier integrity, maybe managing gut inflammation directly, and trying to calm down that systemic inflammatory response.
Okay, so just to bring it all together then for everyone listening, this study out of the Medical University of Vienna, it makes a pretty strong case. A strong case that this persistent post-COVID fatigue, even after mild infections, even in young, healthy people, seems tightly linked to a weakened gut barrier and increased inflammation, especially if there were already some GI issues beforehand.
Exactly. This work, led by researchers like Dr. Untersmeer-Elsenhuber and Dr. Rohrhofer, it really opens up some exciting possibilities. Possibilities for, one, better identifying people who are vulnerable to this kind of long-term fatigue, and two, developing more effective treatments that actually focus on gut health.
Right. So given these findings, this link to the gut's role in recovery, here's maybe a provocative thought for you to consider. How might paying more attention to your overall gut health potentially influence not just recovery from viral illnesses like COVID, but maybe your overall resilience, your well-being, perhaps in ways we haven't fully appreciated before? Something to think about.